Hey, what's up guys? I'm David Hinden. I am a trauma surgeon and a YouTuber, and today is going to be part 2 of reacting to some of the most popular videos by the hilarious Dr. Glaucomflecken. We're going to be watching them together for the first time. Let's go.
4th floor, short stay unit. Where's your secret hospital bathroom? Dude, I'm not telling you. That would defeat the purpose of the...
Okay, so there are 2 types of people in the hospital, 2 types of residents at least. Those who have a secret bathroom somewhere in the hospital for going to the bathroom in private, and those who admit to having one.
Bed up. Bed down. Put the bed exactly where I want it, please. Reverse Trendelenburg. That's regular Trendelenburg. I need reverse Trendelenburg.
So Trendelenburg is actually a thing. It has to do with which position the patient is in terms of the patient's angle. So when we say Trendelenburg, we mean that the patient is angled so that their head is pointed towards the floor and their feet are pointed up. And reverse Trendelenburg is the opposite of that. So we will ask for those different positions in the operating room depending on what type of exposure we're trying to help ourselves with in the operative field. But everyone should be more polite than this guy.
Dr. Trendelenburg is rolling over in his grave right now. Hi, I'm here for my interview. Come on in, I need better exposure. Nurse, retractor. Oh, the last applicant didn't even offer to retract during his interview. Well done. Oh, I'll do this all day. Tell me about yourself.
Oh, God.
I'm an only child, orphaned at age 12. Your parents died? No, I disowned them in 6th grade. Why? They were both internal medicine doctors. Oh.
Okay, that's so wrong, but that's great.
Please accept my condolences. Thank you. So why surgery? Well, after completing my first 24-hour surgical call, I knew I wanted to feel exhausted for the rest of my career. What are your strengths?
Terrible, but sometimes true. It can be exhausting to take call for 24 hours. The silver lining is that as you become more senior, and certainly once you're an attending, that happens less and less often. And for many attending surgeons, they don't take 24-hour call at all.
Tying one-handed knots. What are your weaknesses? Maintaining relationships with family and friends.
Okay.
No, I asked for a weakness. Oh, estimating blood loss. How's your temper?
That's actually true. Anesthesia often asks us what our EBL was, or estimated blood loss, and it's hard to sometimes give a totally accurate answer for that.
I don't have one. You willing to work on that? Yes, sir, of course. Your patient has an intraoperative complication. Name 5 things that anesthesia did wrong.
Okay, so this is a stereotype that I hope doesn't happen anymore, but there's a stereotype that surgeons always blame everything on anesthesia, even though it's often, almost always not true.
Patient moved, bed too low, blood pressure too high, they played a song they didn't like, and they looked at me funny.
Oh,
As a surgical resident, what would an ideal week look like for you? Working so many hours that I fall asleep standing up and have word-finding difficulties, all while convincing myself that this is actually what it takes to be a surgeon.
So unfortunately, that's a stereotype of surgery that you just like to work to exhaustion. But the good news is that's not really true. I mean, there's a generation of surgeons who are being trained right now who really appreciate the importance of having balance in life and having passions outside of the OR. And it's important to have a robust and intense training, but this is going by the wayside, this kind of culture where that has to be the only thing you want in life.
Where do you see yourself in 10 years? Perpetuating a malignant culture because I've successfully convinced myself that this is what it takes to be a surgeon.
No.
Where do you see yourself in 20 years? Receiving a teaching award for my contributions to surgical education. Is surgery a job? No. It's a calling.
Okay, that one's actually kind of true. I think one of the nice things about medicine, even with all the burnout that people have these days, is it feels different from a job. It feels different from just going in and punching the clock and going home. And I know personally that if I won some sort of mega lottery and suddenly had more riches than I could spend in a lifetime, I would still want to go to work and want to go to the hospital and take care of patients in the operating room. And I think there are very few jobs out there where people would be able to say that.
And how do you answer that call? By yelling at it for no reason in particular. Rank to match, my dear boy. Rank to match.
Okay, that's good. Now, if you want to see more reaction videos, I'll have it linked up either here on the screen or here. And if you want to see a video that I haven't filmed yet, let me know in the comments below. I'll see you soon.